Today, I would like to share with you what we know about cholesterol from science and research. This is really important for keeping your heart healthy and lowering the risk of heart problems. We invite you to consider this in terms of what matters in your own life. For example, how could better heart health fit with your personal life goals and priorities? This video explains what healthy cholesterol levels are and tips on how to make yours better. Cholesterol is a fat-like, waxy substance found in blood. Our bodies need it to make new cells, certain hormones, and vitamin D. It comes from two sources: your liver and some foods you eat. Cholesterol is measured with a blood test, sometimes called a lipid panel. The test shows several numbers, including total cholesterol, low-density lipoprotein, which is also called LDL, high-density lipoprotein, which is also called HDL, triglycerides, and non-HDL. Having high levels of LDL cholesterol are connected to heart disease and stroke. LDL, or low-density lipoprotein, is often called bad cholesterol because it can build up on the sides of your arteries. This buildup is called plaque. Lowering your LDL can help lower your risk of heart disease and stroke. For most cardiac rehab patients, it is recommended that your LDL be less than 1.8 millimoles per liter. HDL, or high-density lipoprotein, is often called good cholesterol. A higher HDL level is better because HDL is protective. Your HDL should be greater than 1.0 millimole per liter. Non-HDL is your total cholesterol minus the HDL, or the good cholesterol. Lower levels are better for your health. Triglycerides are a type of fat in your blood. Having diabetes, an underactive thyroid, kidney disease, or liver disease can raise triglyceride levels. Drinking a lot of alcohol or eating foods high in cholesterol, saturated fat, and trans fat can also increase triglycerides. Your doctor may also measure apolipoprotein B, also called ApoB, and lipoprotein(a), also called Lp(a). Apolipoprotein B is a blood protein that helps carry cholesterol around the body. It's measured to check the risk of heart disease, and it can be more accurate than a regular lipid panel, especially in people with conditions like diabetes. ApoB levels can change as a result of treatment, so it's measured regularly. In Canada, a target value for ApoB is less than 0.8 milligrams per deciliter. Lp(a) is measured once in your life and is linked to your genes. It helps determine your lifetime risk for heart disease. An Lp(a) greater than 0.5 milligrams per deciliter is considered higher risk. What contributes to cholesterol? Most of your cholesterol is made by your liver and is controlled by your genes. Some people inherit high cholesterol levels, which can increase their risk of heart disease earlier in life. We also get some cholesterol from our diet, from foods such as dairy, egg yolks, and red meats such as beef, lamb, liver, pork, and poultry. Taking your medications regularly is very important for cholesterol control. The first treatment for high cholesterol is using statins. Some examples include atorvastatin, rosuvastatin, simvastatin, or pravastatin. Research shows that statins lower LDL, the bad cholesterol, and triglycerides. They help reduce plaque in the arteries, lowering the risk of heart attack or stroke. If your cholesterol stays high, your doctor or nurse may suggest adding another medication. Ezetimibe is a medication that works in the gut. It stops your body from absorbing cholesterol. It can work well on its own, but works better with a statin. There are 3 injectable medications that help improve cholesterol. They are evolocumab, alirocumab, and inclisiran. These medications work in the liver's cholesterol-making process and can dramatically lower LDL levels in the blood. Your doctor or nurse will talk to you about these medications if they are right for you. Making heart-healthy food and lifestyle choices can improve your cholesterol. Here are some tips to help you stay heart-healthy. Choose a variety of whole and minimally processed foods at each meal. Fill half your plate with fruits and vegetables. Choose whole grains. Choose more vegetarian options, such as beans, lentils, tofu, and nuts. Choose leaner meats, like poultry without the skin on. Limit red meats, organ meats, and processed meats. Include fish several times per week. Choose low-fat dairy with no added sugar. Drink water to satisfy thirst and avoid sugary drinks. Cook and eat meals at home. Limit eating out. Achieve and maintain a healthy body weight. Continue with exercise and physical activity. Be smoke-free. Smoking keeps your HDL, the good cholesterol, low. When you quit, your HDL levels rise within a few weeks. Cholesterol is important for your health. High levels of certain types of cholesterol can lead to heart disease. If you already have heart disease, there are ways you can lower your risk of future heart problems. Knowing your cholesterol levels is a good place to start. Taking your medications and choosing heart-healthy foods can also work together to help you lower your risk. If you have questions about your cholesterol, talk to your cardiac rehab nurse or doctor.